My name is Dr. Louis. I'm a community pharmacist, and I'm also the president of the Pharmaceutical Society of Kenya. So we have a 4-part series titled the business part of our noble profession. Yeah. So it has 4 parts. The first part is what we'll go through today. And it's just really an introduction where we'll talk about the personal and business leadership. Next, so it has 2 parts. The first part, that's the first part, the introduction. Then the second part is the essentials of managing community pharmacy, where we'll tackle issues around the business model on one session. So are you doing a startup or thinking about doing a startup? You're employed somewhere, you've been employed, or you want to retire and run a startup pharmacy, community pharmacy. What's the model you should be looking at? And how does a business, because a community pharmacy is actually a practice and a business. So how do you ensure that the business of that practice works well? You anticipate it well and works well. You want to grow. You've been running this pharmacy. It's been maybe stuck at a plateau for the last several months or years, and you want to invigorate it, take it to the next level. What are these models you'll be looking at? The third session will be about the processes and performance management. So basically, we are looking at how, what are these things that we need, documented things that actually you need to be waking up. If you look at your business today at a snapshot, you're able to know what's the health of this business. How many, how many months of runway do we have? Yeah. So we look at that processes and how then do you know, what do we talk about, with our team? It's not a surprise that at the end of the month, things are the way they are. What are these things that we set out as objectives, or that you need to set out as objectives, so that the team can be well, including yourself, can be well guided. And finally, we'll deal with what majority of healthcare workers really don't like, financials and cash flow management. Looking at what are these 3 books that you need to be always on top of, so that you can know really the health of your business. In addition, of course, to the clinical aspects of your training, the training that you've been trained as a pharmacist and pharmaceutical technologist. So that's really an overview of what we'll cover over the next 4 sessions. Today, we'll delve into leadership. So looking at personal and business. You're an owner of a pharmacy, you've invested in one, that's where you're practicing. These are some of the questions that we like to sort of jog your memory on, or jog your mind on, and leave you even chewing more, and with some assignments going out of this and insights. So how can I practice and run a healthcare business, in this case, your pharmacy, without succumbing to the loss of ethics and meaning? The meaning of, why did I come and start this pharmacy in the first place? Before you worry about losing the meaning of that, you must know, why did you start the pharmacy? Number 2, what constitutes effective leadership? And in what ways have you experienced it yourself and demonstrated it? Many will say, this is how I lead. But I think I'm a believer that, yes, you experience something first, then you're able to pass it on. Finally, what are opportunities? What are the existing opportunities to enhance and advance this type of leadership that we'll be talking about today? Yeah, so on the chart, please put, if you can, why did you choose the career of community pharmacy? Over all the others. Could have become a med rep, could have become a hospital. You could be working in a hospital. You could have worked in wholesale. You could have worked. Why did you choose community pharmacy? So some of us chose pharmacy. You just, were attracted to to helping the sick in society. Thanks, Jamila. To be self-employed, sort of drive your own destiny, generate income, give a chance to interact with patients directly, to be a business owner, self-employed, passion, because I enjoy serving the community, flexibility of the career. Interesting. giving back to society. Some of us were educated by the communities where we came from. I was educated in my community. I remember the person who paid my school fees for the first term, and um, the challenge they gave me was you have to come back, and serve. Community pharmacy has more exposure to different medicine and brands. Yeah, maybe you are interested in looking at those and seeing how they impact the patient, serving community. All right. I think they generally all would fall in one way or the other into these three sort of categories. Number one, ought to serve. Yeah, you've had guys are called to serve. But the important thing to remember is, as a professional, you have been given delegated mandates. Yeah, um, and this mandate is given to you by the Constitution. It says that there shall be a profession and laws of the country. There shall be a profession called pharmacy, um, and globally it's known, yeah. And this is who is in that profession, and this is what they do, yeah. And we the public cannot treat ourselves. We don't have the time. We don't have the patience to go sit in class as a pharmacist or a pharmacist. We don't have that time. Yeah. So how do we, look for a certain kind of people who are unique enough, to be able to come and do this particular job? So that is a delegated mandate you are given. Yeah. And again, remember their constitutional rights that the public have. Article 43(1)(a) talks about highest quality of care. Number 46 talks about consumer rights. You should be able to, entering the healthcare system. Are there leaders that have inspired you in this? Because, like, remember we said when we started, before you can claim to be a leader, you must have received this leadership. Yeah. So where did you receive your leadership? As we wait for guys to put on the chat there, I can talk about the late Dr. Lando. It's really an inspiration for me. When I started community pharmacy when I did my internship, it was in 2006 in Mombasa. And Dr. Lando, who sadly passed on last year, was very welcoming. Many of you I think a lot of you must have passed through. If you are in Mombasa, a place called Ambalal House, it was a pharmacy down there. I think today it's a Good Life or something like that. Yeah, but it used to be Dr. Jaden's Lando's pharmacy, and I could see him interact with his community. He was a community pharmacist. He would be the doctors on Ambalal House would consult him and be able to listen to his word, and that really inspired me and wanted me to grow more and be a problem solver. The community in Nyali, CBD of Mombasa, all the way to Mtwapa would look up to him as a community person. Yeah. And that inspired me, because I remember when we sort of went into community pharmacy, we'd find you go to a community like Kasarani, Zimmerman, Donholm, you become sort of an elder, a community person there, because of your position as a professional. Yeah. And I think that's something that I learned from this man, Dr. Lando. Is a family man. He was able to interact. I think someone said one of the things that they liked about community pharmacy, is that the flexibility gives you. The flexibility to be able to even, bring your children, family into your business, and you're able to, they're able to see, you at work and things like that. I think in some organizations and fields, it doesn't really provide you that. He was also a public health champion. That also inspired me to get into public policy. And a great innovator and a challenger. You would always receive a call from Dr. Lando challenging you. Where are you? What are you doing to help community? And a great collaborator. He never did something by himself. Yeah. Yeah, so thanks, guys. I can see guys presenting leaders there. Dr. Gidinji, I think I know that Dr. Gidinji, your first employer, that must have been what, Pentafarm, or where was that? Ketani, I remember you, yes. Director Transchem, that's Dr. Kibe, Dr. Muli Belea. Yeah. So there must be something that you picked from there. So, there are different leadership styles. There's a transformational leadership style, a leadership style that, it doesn't leave you the way it found you. You come there, half of the team is complaining. Bima Patel of Cosmos for sure. Half of the team is complaining about the work, but as you go through the work, again, half of you again transformed. You're not the same way you came in. And one of the things that also, for um, open to it, it's not just you, the leader who is training the person who is going transforming others. It's even you get transformed because there's something called reverse mentoring. Yeah. So that's what transformational leadership is. Oh yes, Dr. Irungu is also one of my mentors. I wouldn't be here for sure without Dr. Irungu. Transactional leaders, this is life. We sign a contract. I'm just here. I don't want your stories. I don't want to hear your growth goals. I just want to, you said you'll buy this, buy, pay, and that's a form of leadership, it's just very cutthroat. And I think you can give examples you don't have to give examples of those, but, in other industries, you'd find, leaders who just, it's just purely, no relationship, but in a professional kind of way, we don't do a lot of transactional leadership. Servant leadership, I see a lot of this in leaders who sort of work at meds. I think of those of you who have interacted with the leaders at meds, they have this attitude of, attitude of service, but also just, I think community pharmacy is about service. Yeah. And I think you community pharmacy owners, I think you even, you'll find the community comes to you, consults you, for these services. And so you have to really have a heart of service, or else, go do another practice. Yeah. Situational, different kind of situation rises, like our maybe political leaders, the leaders in PSK, KPA, HOPAC, and so on and so forth. Yeah. Thank you for acknowledging your leaders, and I'm sure they're great. If I will give the mic to each of you, there'll be great things that you'd have to say about that journey. Now, you can't be a leader without certain tools. Yeah, because as you lead, you're either taking a walk or you have people who are following you. And if you have people who are following you, those people are hoping you have done your homework about this business that you're entering into. They are hoping that, you are humble enough to seek help, when you need, that you are interested in enough about them and where they are going. And who are these stakeholders that you have? You have your employees, you have your clients. Yeah. There's nothing as sad as opening a pharmacy and closing it, and the community is wondering, where else would we get medicines? Yeah. Of course, there's also your trade partners, your wholesalers, they are also expecting that you've done your homework. Yeah. And you are open to receive some feedback, criticism of sorts. Yeah. And the most important, also your future self. Your future self hopes that this investment you're putting in right now will mean something 10 years from now, or even your family for that matter. Yeah. So you need to be able to be prepared well for these things. So one of the tools that I've found to be very useful is the pestle analysis, the political landscape. Are you concerned about, are you aware of what the dollar is doing, and the impact that has on the cost of medicines? Yeah. Policies around universal health coverage. Now we are going to shift away from NHIF. What does that mean for you in the community practice? Economical impact, the economy is the way it is, it's contracting. What does that mean for you? Social, what are the disease patterns? What are they changing? What are you seeing changing? And does that mean you have to upskill? One of the questions I actually wanted to ask in the previous slide, and it's something that you all need to, think about. It may be a touchy subject. Do you see a role in, levels of practice in our profession? Do you see a role of career pathways, from pharmaceutical technologists to pharmacists to specialists. Yeah. Do you see that role? Because the landscape is changing. The client will demand more from you. And you can't go, because of consumer rights and just ethics, you can't just go pretending to be something that you're not. Yeah. So you have to go back to school and upskill. Yeah. And so that you can be able to offer services that are able to, even you feel like you're not hiding and you are, playing games around there. Technological, how are you leveraging technology? How are you leveraging, increased mandates and things like that? Made possible by technology, environmental policies that are affecting you. Counties have come, counties want to do this, counties want to do that. How is that affecting you? And of course, legal. In the pharmacy sector right now, we are seeing a lot of changes in our laws. We have the KDA bill, and also that is there to sort of help structure the country's regulatory framework, and also the pharmacy practice bill that comes to regulate the practice of a pharmacist, and also the services offered by them, as well as also pharmaceutical technologies, the two cadres in the pharmacy practice in this country. Let's look at the macro. Then we have to look at the environment and all those things. What is the size of the business, and what is your, I would say, what is your capacity of it? Yeah. I think we are almost $1.5 billion US dollar market size in the country. A lot of that is majority of that is public sector, is almost 50-50 public sector and private. Majority of public sector is run by KEMSA and MEDS. On this slide, it's actually the reverse. Majority is public, almost 70%, and the rest is because you have things around USAID giving, ARVs, all those things, plus the normal medicines that we have that KEMSA buys and MEDS buys. Then the rest is so that is investor. Please note that. Sources of our pharmaceuticals, almost 70% of what we consume is imported. We have, I'll talk about registered pharmacies or pharmacies that are known. I would say are 10,000. Half of them are public sector. So you have your level, 2, 3, 4, 5 upwards. And the registered pharmacies. Majority of those don't register. And actually, if we are to move and advance in this country, we need to see both public and private pharmacies registering so that we can actually provide leadership that is necessary. You can't have level 2 facilities not having pharmaceutical technologies. You can't have level 3, 4 not having pharmacists. This is the business of those two cadres, yeah, and it's up to us to sort of rise up and sort of provide leadership, because actually the public are waiting on us. It's us who just need. What are the things that keep you up at night? Quacks, lack of ethics. Yeah. What else? Yeah. So quacks. No one is kept. Counterfeit medicines. Yeah. Barbara, thanks, Dr. Barbara. Corruption, as in failed pharmacy. Yeah. And actually, corruption thrives in lack of leadership. I think we'll discuss it a bit more. Fact that quacks survive while professionals suffer. That's true. You actually find no week passes. I think this is also a testimony to any of us. No week passes before someone asks you, I'm trying to start a pharmacy, and that person is not even a professional, so you wonder, they have so much confidence than actually the professionals the way themselves. Thanks, Rogers, in Takada Tassels. I was about to make a joke that no one can, I thought someone would guess one of mine is the fights between PSK and KPA. The conceptual challenges we have, and I think those are things that we need to address because the issues are, they are live, and actually those issues are the ones that keep us from this profession from advancing. We need to look at what's best practice and how do we improve. And I'd asked a question earlier, and I think I was hinting to this. Do you think our profession has room for, career progression? Yeah, is that something that we need to look back at? Yeah. And what's will we benefit more by having clear pathways of advancing career-wise, that a pharmaceutical technologist can see how they advance? Or do we just want to sit back and say a farm tech is equal to a pharmacist? Yeah. To help with the patient, to help with the public health system. I just want what is mine. Or a pharmacist on the other side saying, no, a farm tech can't be a pharmacist. So those kind of things. Of course, competition. Um, yeah. The economy, of course, that's an issue right now. I was speaking with a colleague the other day, and they're saying the last 1 year things have contracted. Patients are seeking to take a tablet at a time, or even medicines that they used to buy once a month. I've actually even experienced this myself, where a patient promises to come and take 2 packs because they haven't been taking their medicines, to keep one at home for when they've traveled. But the honest fact was they were unable to pay. It took 3 people to pay for that one prescription of 2,500. Yeah. Someone had to spend half of the money. They only had this much. And remember, they had ordered for 2 packs. So even patients are embarrassed to be talking about this. They're actually deciding to stay back at home. Yeah. So these are matters that we have to get angry about and sort of solve. Yeah. And I'd like to hear at some point about yeah, what's your role in all that? Limited career advancement, I agree. And these are things we have to solve. Yeah. So this keeps me up at night. Yeah. As a leader in the sector, one of the things that really keeps me up at night is one morning I'm going to be called, and a report has come out about the state of pharmacy in Kenya. And we will find that medication errors are, maybe the first cause of death in patients in this country. Yeah. In the US, where they're measuring, and they're actually not even that well documented, it's actually documented as the third leading cause of death. So where they have documented, they're actually saying almost 300 people die of these medication errors a day. Yeah. 300 people. That's like what can fit, I think SGR can fit 300 people. Yeah. And SGR crashing every day. Yeah. So you have your medication errors. So does your pharmacy, and actually here I wanted to ask this question, does your pharmacy see any business sense? Someone has said competition. Yeah. Does your pharmacy, and these are things we'll talk about next week when you're talking about the business model. Does your business model support these services, and resolving these needs that the public have? The public actually have needs for resolving medication-related problems. Yeah, you're a farm tech. Yeah, you've seen this client has come to you. Do you have a pharmacist that you work with and you're able to refer? Yeah, you're a community pharmacist. You're working somewhere. Yeah, are you able to resolve something? Yeah. Are you having collaborative agreements with farm techs in your locality, with doctors on your locality? Yeah. You are a specialist pharmacist. You're at the KNH, KUTRH. Are you plugged in with your community pharmacy network? Yeah. That you are able to be a resource. Yeah. And can you be compensated for that work? Yeah. So does your pharmacy see any business sense in resolving this, or the only thing it can do is just sell medicines? Yeah. So these are leadership questions you need to ask yourself to be able to sort of go backwards and say, okay, what would it take? If competition was not the issue, how would I solve this matter? And some of these questions, you cannot solve them by your own self. So you need to come together and ask these questions. Like-minded individuals, like I've said, you're in Nyumba Kumi, within Park Kilimani. Dr. Barbara, do you know the other 10 pharmacies within your locality? Do you know which ones have pharmacists, which are pharmaceutical technologies? Do you know the doctors within your locality? Are you able to do referral? Are there adverse drug reactions happening? They are documented. Drug-drug interactions, drug-disease interactions. That's where you have, someone is taking a medication and it's interacting with the disease state. they have kidney issues and it's overloading their kidneys, overuse and underuse of medication. You have a patient who's taking glucophage, one brand and another brand at the same time, medication and adherence. Like this patient who comes and says, I did not buy medicine last month because I couldn't afford, actually. Yeah? So how are you resolving this matter for them? How are you as a leader in that community stepping up, yeah, to even know that this matter is there, to even propose that they actually go back to their doctor and talk about these other alternatives, yeah? Even if the patient is on non-substituted medicines, they need to be given information and go back. Medication costs, I've talked about, lack of patient education. These are things that keep me up at night, yeah. And I strongly believe that as we look at PPB getting stronger in the practice, because actually PPB, the practice directorate, is actually being strengthened. As it's being strengthened to regulate the practice of pharmacy in this country, we need to see this community of community pharmacists coming together and solving these problems. We need levels of practice defined so that they can be interest from a pharmaceutical technologist to advance in their career, for a pharmacist with a B Pharm to advance, yeah, and go get a specialization, for example, yeah, and then be compensated. So those are conversations that are happening right now, and this is where I would say, as public participation starts coming in, we need to look with a long-term horizon, yeah, with our leadership glasses, as opposed to just saying, no, what does this mean for even me? I want this. No, we need to structure the pharmacy profession in a way that there's career advancement and there is, because it's our people who need these services. If all of us just act like crabs and, pull each other down, we'll all remain as entry level of pharmacy practice just remains pharmaceutical technologists, and then there will never be need to grow, yeah, from a pharmacist to a specialist and things like that, yeah. I think as a leader, you must have this sort of hard conversations and collaborate and see how we can work together to solve these things. The other problem that actually keeps me up at night, and it also stresses the inquiries and disciplinary committee is of the Pharmacy Employees Board, is leasing of licenses, yeah. And the thing about leasing of licenses, it's like giving up your birthright. There's this story, those of you like reading books and literature, the story of this guy who is a firstborn, was given a birthright. Just like any patriarchal community, he had a birthright. He's a firstborn, he's the one who lead the community and things like that. But he comes back, he has no self-control, he's hungry, he finds his brother with some lentil soup, ndengu, and he insists that he wants to eat that food. Then his brother says, okay, can you trade your birthright? Can I be the firstborn instead of you? And he actually said, yes, he didn't care much about that. And that's really what we're doing when, we are leasing our licenses, yeah? Because you end up having now people who actually have no interest in the profession. And that's really the face of the profession, the community pharmacy. 70% of the public at the first point of care, they come to the community pharmacy. And when they come there and they don't find you, they find your license there and you're absent. And these are things that the Pharmacy Employees Board, together with the PSK and KP on the other side, are trying to help us as the practice is being strengthened. Yeah. So there are opportunities in that. That's one side, but the opportunities, self-regulation is one of them. PSK has been given a mandate to self-regulate for pharmacists, while KP has been given a mandate to self-regulate for pharmacists. What that means is administering of ethics, doing nyumba kumi. I strongly believe nyumba kumi needs to also work with all pharmacies in that locality so that we can also have inter-referral and strengthen and sort of build that camaraderie. Yeah? Chain of pharmacies are not enough to meet the need. The majority are independent pharmacies. Majority are not the chain pharmacies. Yeah. So how can we do the nyumba kumi and strengthen spot inspections? PPB has mandated PSK, so you belong to PSK or KPA. Just take a photo of that place that you think has a quack send it to PSK. The PSK CEO is the number is public knowledge, is on PPB website. Just send it to them on WhatsApp, and they'll be able to report it and follow up. You just need to suspect. You don't need to be sure. Yeah. Regulatory strengthening. KDA is coming to strengthen the product element and just how the product enters the country, how is supply chain happens like that, and that is in Parliament right now. And just to demystify it, it is not coming to replace the farm tech and the pharmacist. It's taking what is already there right now, from wholesale upwards to manufacturing, and strengthening it as per best practice. You have the pharmacy practice builder, then comes to deal with the two cadres, yeah, pharmacists and pharmaceutical technologies. And of course, levels of practice are something that is coming. PPB is introducing, already had introduced that, and it's just strengthening that. We are seeing disease shift and consumer pattern shift. So we are no longer treating diarrhea. Yeah, like what we used to treat in those days. Now we are seeing the big killers are hypertension, diabetes, and things like that. And that's now why you have to upskill. You can't just come back with just the knowledge that you left with the, university or from college. You have to come up and serve the customer with new knowledge. And that's where it's demanded actually by the consumer rights. You have to look at Article 46 of the Constitution. We are seeing primary healthcare focus in the country. So that means expanded role for the pharmacy. Pharmacists are being expanded their role, and the pharmacy itself is being expanded its role in serving the public. And, where are you in there? Yeah. And what levels of care are you giving? And that's really the mandate of PSK to do that. And I can't really overemphasize the issue about upskilling. Right now, we are seeing that, and I think someone had mentioned it earlier, there's no incentive for a bee farm to upgrade to, specialization, because, and then what? What services will I provide? You are finding pharmaceutical technologies doesn't want to upskill into a pharmacist, because they would rather go do some procurement and become a procurement manager, because at the end, it's also, people have to provide for themselves from their profession. And PPB, that's the challenge to the PPB practice, and they're actually stepping up on that. Some changes are coming, and with the levels of practice, I'd like to commend that directorate. I think it's really long overdue. We need those really defined so that there's really incentive for people. You can never be a leader who is not self-aware. So leadership of others starts by leading yourself. So, what's your state of level, what's your level of self-awareness? Yeah. And that starts with appreciating that your life has different facets. It's your business. You can't just thrive in your business only. So your money, your finances, your career, your work, how you earn your money. You have your creative life, your health and wellness, fun and recreational. How are you spending your time? PSK has this meeting where it has them outside the, in the national parks and things like that. Social life, your extended family, the community you serve. Are you a community leader where you are? By virtue of being that birthright of the registration you get by PPB, you actually have a right to be a community leader in your community. Parenting, so your love life parenting and your spouse, and life purpose. Are you growing? Are you learning? Are you growing in that career? So you need to be able to have a vision of, remember I said you have to be angry about something. You remember the things that we were getting angry about, huh? These things, yeah, and the things that you wrote. So you have to have a better vision of it. It's not there right now, because people will say it's not there right now. One of the people who really used to inspire me in this was the late Dr. Ombega. Actually, Professor Ombega used to be a farm tech. He upgraded all the way to a professor. He used to talk about things that were not there. Clinical pharmacy, yeah. A pharmacist in the world, a pharmacist in community pharmacy doing expanded services. And it has actually come to pass. That's the late Dr. Professor Ombega. So you have to have this vision, and what are you doing? How is your practice drawing towards that adaptability and flexibility? It might not look like where you're going, but how are you changing? It might fail. How are you picking yourself up? are you belonging to a community? Because also you can't do these things by yourself. Some of the things I learned when I was working with Dr. Lando, the late Dr. Lando, was you have to have a group of people that you're talking with. Yeah, I know in pharmacy, especially, it's very competitive. You think if you talk with another, the 10 pharmacies around you, they'll steal your patients. But really, it's not about that. You need to come together to even better understand. If you're not having, and I'll talk about this more in the, I think the third one, where you are looking about strategies to improve your business model. If you want to grow, you have to do that. If you refuse to do that, you will not grow. Yeah, there needs to be effective communication with your team members, empathy and emotional intelligence. You can't lead other people without this. Yeah, you must be able to see them before you instruct them, or demand something of them. Yeah. And of course, continual learning and growth. Yeah, what does that look like? You belong to a group that is asking you hard questions about growth. Huh? I'll give a case study. There's this gentleman. He was asked. He's reflecting backwards and saying, why did he really get into community pharmacy? Yeah, and just like majority of you who asked about the money, it was really about the money. And actually, when Dr. Lando inspired me to come into community pharmacy, I must confess, I didn't go speak with him about that desire. I was actually filled with sort of envy or desire. My desire was, Dr. Lando drives a big car. I want to be like him, So I can't go and start talking to him about that. Yeah? It's like I'm being driven by envy. So, unajificha, unaenda unafanya vitu zako, you do your own things, and you don't really. So even how I started. So and most of you might be there. You're working for Dr. Irungu, you're working with Dr. Kibe, you're working for, all the people that you said are inspiring you. I have to go back. And you sort of have this desire that is filled with sort of envy, and you just secretly go and start your thing. And so you die. I remember in pharmacy school we were taught sociology, and that's the first time I came through this Maslow's hierarchy of needs. And by the way, I chewed that thing and said, this is how my life is going to be led. Sort my physiological needs, safety, my family is okay. We have money, we are growing in terms of money in the bank, things like that. People know me, people who know who I am, and I'll be self-actualized. Yeah. So I'll tell a story of this guy. He's leaving university or college. So he's asked by his mentor, why do you, what will you do? What's your plan as you leave? He says, you know what? I'll go work for Dr. Irungu, yeah, and I'll work for him for 3 years, and then he was asked, and then what? After that, I start my own pharmacy, and it will do well and grow. We'll have money. I'll marry my wife because now I have money. I'll marry a wife. I'll have 2 children. I'll take them to the best schools, and then what? I'll educate my children. They'll have good jobs like that. And then what? You start thinking, oh, and then I'll retire. I'll go with my wife now. I'll have time for her. We go and for a cruise ship. Now cruises are coming into Kenya. I'll take a cruise ship from Mombasa, South Africa to the Maldives, or wherever that is. And then what? Then the guy started, kuyumba yumba. And then I'll die, So his mentor asked, the problem with your plan, it is too small. Yeah. It's only focused on you. Yeah. You. Yeah. And by that I could relate to that, because those of you who know, I actually live this plan. Yeah. And it's good, by the way, you love money and all those things, but it's only focused on you. Yeah. And you're consumed on very transitory things, transitionary things. Yeah. After you die, it ends. There is no after that. Yeah. There's no legacy. There's no impact. There's no person's life was been changed, transformed. It's only your money in the account. Maybe your children have drunk it. They become drunkards, drug addicts, like that, because you were never there and things like that. So I propose a different leadership of inverted one. Yeah. It's called the hierarchy of collaboration. It really requires you to get uncomfortable with status quo. Yeah. that sort of to have that leadership transformation mindset, yeah, that looks at things and say, even if majority of the farm tech say this, or KPA says this, or majority of PSK say this, or PSK says that, I know what is right. Yeah. Right is right. Light is light. Yeah. Light cannot be darkness. Yeah. So I need to be able to lead with plans that are beyond myself. How is the society impacted by this thing that we are really, focused on? Yeah. Are the things that are consumed, that I'm consumed by, generationally, are they about legacy and impact? Yeah. One of the people really inspires me in this is Dr. Irungu. His business, his family is there. Of course, Dr. Kibe, his children are pharmacists as well. So you can see there's more to it. And even not just his family, there are many of you who've been impacted by that. Yeah. Dr. Kailemia setting up a manufacturing plant. There are many, and I don't have really the time span now to list all of them. And maybe I will call on them and challenge them to also come. One of the reasons why I'm doing this, participating in this webinar, is to inspire them also to come and tell their stories in this way. Because they might not be able to teach you on molecules and things like that, but they can teach you on this sort of leadership aspects that help you sort of plan yourself and be able to help your business to be successful. I think that's the end. Session one, remember what it was about. Session one, we said we want to know, how can I run my business of health business in a way that prevents me from succumbing to loss of ethics and purpose? Yeah, and I think you've touched on that. What constitutes effective leadership? You gave an example of effective leaders and what really, how things that they put in place to be able to do that. What are the opportunities to enhance your my leadership? And if you doubt the opportunities are this one, yeah, how are you? The things that we said we are angry about, what role are you doing? Yeah. When you see your group of people misbehaving and things like that, how can you say, no, guys, we are not boarding that one. This is what we are boarding. I'll go look for the next 10 pharmacies around me, and we will change our locality. Yeah. If you guys don't want, we will change it. Yeah. We will move and partner even with PSK, for example, and just move if that's where we need to go, or whoever is behaving and things like that. Because we want to move ourselves to a place where the practice needs to change. Let's have had enough of this. Yeah. We can't have every Tom, Dick, and Harry wanting to open a liquor shop and a pharmacy. Yeah? Yet pharmacists and pharmaceutical technologists don't have even the courage to be able to do that. They can't even see career progression in their profession. And I think this is a challenge to both PSK, PPB. At least I know I lead those places. I'm in those places, and also KPA. We have to really up the game, remove selfish interest, and now sort of lead towards that. It's about the public and the profession, and that's leadership. And you as a member, that is your role. Your role is to keep us accountable on that. When you see any funny business, no, we don't want that. So we'll talk about, next we'll talk about the business model. These are the essentials of running a community and managing a community pharmacy. I'll delve into what I've been training. Like I said, I've been coaching others on private equity invested pharmacies and hospitals around the business model. Are you a startup? Are you growing? What are things you need to look at? What mindset do you need to have? What are these things? Processes and performance management. It's not just about stories. Oh, the clients, oh, it's the economy, all this. No, what are the processes and things that you're using to track? Yeah. And financials. Yeah. You need to know at least 3 books. Yeah. To be able to ascertain that, yes, this business of yours, this practice of yours will see 10th year anniversary. Yeah. I was speaking with Dr. Chieng, the practice, some time back, and he told me every year, 1,000 pharmacies never see their next renewal. Yeah. So that's really, that means 1/5 of every registered pharmacies every year never gets to the next year. And those are things that we need to reverse. Yeah. And it will take collaboration, inter-cadre collaboration. Yeah. Because we're all human. We are here, we're on the ground. How do we collaborate? How do we promote, levels of practice? How do we promote career progression in the profession of pharmacy? Yeah, we can't lock people from progressing, or else then the profession will die, will atrophy. Yeah. It will be very good one day if we have 10,000 pharmacists in this country, because that then means that from public sector to private sector, public will have access to your services. Yeah. And specialist pharmacists, again, just the pipeline growing upwards. So yeah, I think I'll leave it there and take questions. Amos, thank you.
Thank you. Dr. Machoko, for that. This is quite insightful, Doc. It's quite insightful, especially the part of what really makes me, have sleepless nights. I'm sure tonight many of pharmacy providers are really rethinking of perhaps their business strategy and where they're heading to. I was so impressed, Doc, especially on the part of the inverted pyramid. That sometimes we could have been focusing, as an individual, narrowly on profit part of it. Little do we know that we were to focus on, the society. This is really amazing, now. So it's a point of reflection, and I believe for most of the participants who are here, they are also going to rethink about that. Guys, this has been awesome. Doc has really, cut across, talked about networking, our role, what impact do you need to, live in the society, leveraging on other professionals. Doc, this has been so great. Guys are thinking.
I think we left people thinking. I think that's the success to me. If we left people thinking, and taking notes and just going and chewing on this. Yeah.